I'm Alexander Mauskop, Director of the New York Headache Center. Cluster migraines. There are cluster headaches which are different from migraine headaches. Cluster headaches usually affect men. Fortunately, they're not as common as migraines. Only less than 0.5% of the population suffers from clusters, while about 12% of the population suffers from migraines. More men than women suffer from cluster headaches. Excruciating pain. Some people call these headaches suicide headaches because the pain is so unbearable, even though it's very short, 1 to 2 hours, and the headache is gone. And patients know that. It comes and goes, but the pain is so intolerable they're thinking about suicide, actually. So cluster headaches occur in clusters. That's where the name comes from. That is, you get one headache every single day for a month or two, and then the headache is gone for a year. And then next year it comes back. There are some patients who have migraines and have cluster headaches, and sometimes we can't tell them apart. The difference between cluster and migraines, the cluster is always on one side, in the eye, and tearing is a very common sign of cluster headache, nasal congestion, and people become agitated. Migraine patients would rather lie down and rest and not move. Cluster patients rock and walk around and scream, yell, bang their head against the wall. Very different picture. But again, there are some people in whom we can't tell the difference. It lasts longer than the typical cluster. It does not come in clusters, but it's pain in the eye and tearing, so we can't make up our mind. The good thing is that treatment often is similar. Same drugs can be effective for migraines and cluster headaches, and those include epilepsy drugs like Depakote, Topamax, blood pressure drugs like Verapamil is my favorite. Steroid medication can abort the whole cluster. We use Botox injections for both, but migraines respond better. Imitrex, which is sumatriptan injections, is the only treatment approved for acute cluster headache. We use also oxygen for clusters, which doesn't work for migraines, but Imitrex works for both. So there are many, many options as to treatment of cluster headaches and migraines, and sometimes that overlaps. Both the condition overlaps and the treatment overlaps.